purpose and Mosaic is to plant a seed. Plant a seed in settlement agencies. So every day when we're working, we think about persons with disabilities. Have I served a person with disabilities today? Are there any refugees with disabilities that I have served? What were their barriers? No? Migrant workers, international students, just immigrants in general. And at the same time, we discovered that this can be also new to agencies that serve persons with disabilities. Within your agency, do you actually serve persons with newcomers with disabilities? Is there a language barrier? How do you overcome it? Do you have funding for that? So just planting the seed and initiating that conversation is what we're looking for. And this you can do in your everyday life. We looked inside Mosaic. How many people in our payroll have a disability? Can we ask that question? When we're posting job postings, are we being inclusive? When managers are hiring, are you thinking of a person with disabilities for that position? Are you interviewing people with disabilities, right? Are we seeing persons with disabilities in the workforce? And every single one of us can make that change. So this is a topic that's very close to my heart because I was in charge of designing this program in Mexico at a national level. Of course, it's very different, but a disability is a disability anywhere. And a person is a person anywhere. So another objective I would have is that we stop differentiating, right? And I hope that someday we just have a forum where we just speak about persons and when we don't include the disability. And for lawyers, you know, words are very important. So if we're talking about accessibility, I think the best reference is the Convention for the Rights of Persons with Disabilities, which was also subscribed by Canada. And it's the most ratified document in UN history. And I'm very proud that it was Mexico that proposed that to the world, and that my ex-boss, the Consul General of Mexico, was the one that drafted the document. So I would just like to read Article 9 that talks about accessibility. And accessibility means to enable persons with disabilities to live independently and participate fully in all aspects of life. States parties shall take appropriate measures to ensure to a person with disabilities access on an equal basis with others to the physical environment, to transportation, to information and communications, including information and communication technologies and systems, and other facilities and services open or provided to the public, both in urban and in rural areas. And most importantly for me would be these measures shall include the identification and elimination of obstacles and barriers. So I think it's a very broad definition. Of course, there's more to that definition, and you can see it yourself or Google it. But for me, it's just to have in mind that accessibility is not a ramp, right? It's to be open in your heart and in your mind, and have persons with disabilities present in your life every day, because they are there. 1 in 4 in British Columbia has a disability. According to the World Health Organization, almost all of us will have a disability in our lifetime. But it's very easy to say, oh, I'm gonna help that person. That person doesn't need your help. It needs the accommodations to do whatever that person wants to do. So the persons with disabilities do not need help, they need respect, right? So with that in mind, I invite all of you to give your ideas so we can have more forums like this to continue this conversation. And perhaps that can guide us into a document that will set the framework for more funding, or very, very solid funding with certain policies that have to be changed as a result. And we can build that document together, but most importantly, we can build an inclusive society together. Thank you.
Thank you, Hugo. So I believe the way you have shared the reason for having this forum is really commendable. And I truly believe the kind of experience you are bringing in here from the different geographical part of the world would be really helpful for us to lay down the framework for our vision to work towards newcomers having disabilities. Thank you so much, Hugo. And with this note, I would like to introduce our second speaker, Adrian. And Adrian, please come. Adrian, who is deaf, is the project coordinator of Network Building Project. She is passionate about discovering innovative ways for people with disabilities to empower themselves and each other, including finding new opportunities for engagement and collaboration. Adrienne, who has worked as a communication specialist, freelance journalist, and executive director of a non-profit organization, particularly enjoys learning new languages. Let's welcome her with a big round of applause. Thank you.
Thank you very much. We're going to put the PowerPoint up on the screen now. Okay, yeah. First slide, please. Thank you. Okay, hello, everyone. Welcome to the Newcomers with Disabilities Forum, brought to you by the Network Building Project, which is a collaborative initiative co-led by the Disability Foundation and Disability Alliance BC. This forum is also co-sponsored by Mosaic, and we are very grateful to Hugo Velasquez and his fantastic team for all the wonderful help in bringing this forum to reality. Thank you so much. Next slide, please. So I'm going to start by just giving you a very brief introduction to the Network Building Project. It's funded by the Vancouver Coastal Health and the City of Vancouver. And so the geographical scope of this project and also this forum is services in Vancouver, North Vancouver, and Richmond. So the most important goal of the Network Building Project is, other than easily reaching out to the disability community, is to foster better collaboration between disability organizations to improve the lives of people with disabilities. So collaboration is the big star of today's forum. Next slide, please. So who is in the Network Building Project? It's about 200 organizations. The vast majority are nonprofit organizations serving people with disabilities, but it also includes private companies, crown corporations, and newcomer organizations, as well as neighborhood houses. Now on the screen is an image, it's blurry on purpose, you're not supposed to be able to read it. The reason I'm showing it to you is because that is the Network Building Project spreadsheet, which every member organization has. It can be sorted by disability type and type of service. The reason why I'm showing it to you is because that spreadsheet, that spreadsheet is a starting point. It's what we have now, and what we would like to discuss today are other opportunities for the organizations to communicate with each other easily, to refer clients to each other. And so this spreadsheet is just, I'm showing it to you because that's where we are now, but we would like to talk about ideas for how we can build on this and create better, more opportunities, whether it's through social media or a website, easier ways for the organizations to share information, refer clients, and communicate and especially collaborate. Next slide, please. So the major activity of the Network Building Project is organizing forums exactly like this one. This is our very first forum. And again, on the left side, that's just an image of a report. You're not meant to be able to read it, but what we've highlighted in red, and it's on the right side of the screen, is the reason why our steering committee chose this particular topic for this forum. The fact that the education about the dizzying array of services available to people with disabilities is sorely lacking. And it's very common for people with disabilities not to get the help and support they need simply because they're unaware that specific services exist. And the other information that we found from surveying the network building project organizations is supporting newcomers with disabilities to get connected with the disability community was an urgent need. So based on that survey and these outcome of the survey, the next slide, please. Today's topic is how can we work better as a disability service community to improve services for newcomers with disabilities. By newcomers, we mean immigrants, refugees, migrants. It doesn't matter whether they got here yesterday or 30 years ago. And our goal for today is to come up with practical solutions and recommendations, particularly surrounding improved collaboration between disability and newcomer organizations, but also regarding reallocation of government funding and changes to government policy. So please keep those three things in mind. Next slide, please. So the data collected from newcomers with disabilities, we had 5 focus groups, 2 in English, 1 in Farsi, 1 in Mandarin, and 1 in Arabic. And we also sent out a survey to newcomers. So this presentation is about what they have shared about their experiences living with a disability, also dealing with language and cultural barriers. So and these are the 6 areas we're going to be looking at: barriers to acquiring information, the need for centralization or one-stop shopping, inadequate services or areas where additional funding is needed, changing government policy, role of volunteers, and newcomers helping each other. Next slide, please. So the first area, barriers to acquiring information. This is really the kind of the key, the most important thing. Other than not only do newcomers with disabilities and newcomer organizations are unaware of what disability services exist, but the disability organizations themselves don't know always what the other organizations are or what services are available. So because of that lack of awareness, that translates to the need for better quality referrals. So what the focus group participants are telling us, they don't know about their rights in Canada. And when they try to seek information, contact an organization about help that they need, often they're not able to help, and they're not able to refer them to the right or to someone who can help. So basically, their message is, if you can't help me, at least please be able to refer me to someone who can help, because they hear again and again, we can't help you, goodbye. And after a while, that becomes so demoralizing and so frustrating that many times people just give up and don't want to look further. And the other issue is that if you are going to refer people to another organization, you need to do it with some knowledge and control. One man from Ukraine said he was referred to a fundraising organization that didn't even have direct contact with clients. And the woman who he spoke with was shocked that their organization was recommended that he call them. So it's important that when the organizations are referring someone, to know that it's a quality referral. The next area that we were looking at are the fact that settlement workers lack training about disability. We hear from the focus group participants, often they're told by a settlement worker, oh, I've never had a client with a disability before. We even had a couple of settlement workers in our focus groups. And one said that as settlement workers, we have specific services that we are trained, we know how to do for the client, any paperwork they need, any application, translation, interpretation, citizenship, housing, all the help they need for settling in Canada. However, for special needs related to disabilities, we can't refer them, and unfortunately, we don't know who should be responsible for that. So during that discussion about the need for settlement workers getting training, one person had something very interesting to say, and it was so profound and so well articulated. I asked her to be part of the panel of experts. Her name is Annie Wei. And she told us about a consolidated referral network. So what Annie said, we need to consolidate disability services into a central referral network. Oh, sorry, next slide, please. Into a consolidated referral network. And she gave us an example. Sorry. She gave us an example, the ALS Society of BC, which she is a volunteer for. And what she was saying was that settlement workers have their own special training. Not every newcomer necessarily has a disability. So by training all the settlement workers, you're casting a very wide net where you're not going to really do that much good. As an alternative to putting all of these resources into training settlement workers, we need to create a consolidated referral network. And there's the example she gave from ALS Society of BC. That organization offers a referral network of service providers and specialists to registered patients. They also collaborate with nonprofit organizations serving specific needs, such as communication, technology, medical devices, etc. They navigate, they provide some needs themselves, but they also offer referrals and can fast track people through the application process so people don't have to jump through hoops for each and every individual organization that they contact to access what they need. So, it sounds like a really wonderful idea because it's having a consolidated referral network would serve the entire disability community, which would give a stronger case for funding. And then the settlement workers could still access the information in the consolidated referral network and provide that help to the newcomers with disabilities. So it's an excellent idea. And we hope that Annie will be able to further comment on that. So moving on to the next slide, please. The next area is the need for centralization. We already heard that sometimes the newcomers with disabilities are sort of given a runaround or referred to many different places. They say that they're given a list of 10 different organizations and say, go Google list yourself, or here's a bunch of links that may or may not work, figure it out yourself. That's not helping them. They don't want that. What they were asking for, what they think would be the best is to have one navigator to do that legwork, do that research, gather the information that they need, and then help them directly so they don't have to jump through hoops. That also translates to a need for follow-up. So one Ukrainian gentleman said that before he got to Canada, he got so many letters from different blind organizations, these blind disability organizations, even advocacy organizations, telling him that when he arrived in Canada, they would help him with everything he needed. What actually happened, he got to Canada and all of that sort of evaporated. He said they ignored his letters, they would not answer his questions. He was told they don't have to change just to help him. So in his situation, definitely there was a need for follow-up. And another need that has been expressed in the focus group is a greater need for advocacy. So one blind woman says she's given a list of very expensive equipment to buy, like a $1,600 tool so she could use her laptop, or just to use her microwave, different stickers so she could feel the difference between the buttons, and then each one little tiny sticker costs $5. So basically her viewpoint is, if you're going to give me this list of expensive equipment and you know my financial situation, at least put me in touch with an organization that can help me pay for it, or that can loan things to me or provide for it. The other area of the need for advocacy was with the application for disability benefits. One woman said the minimum waiting time to get an advocate to help her fill out that application is 12 weeks. She didn't have 12 weeks. She had just lost her job, was already facing financial distress. So definitely she had a real need for an advocate to help her with this very intimidating, overwhelming application process for disability benefits. And finally, we're looking at the language and cultural barriers. This is a huge stumbling block for many newcomers with disabilities. One focus group participant is a transgender man from Iran, has already had 7 gender reassignment surgeries, and the implant in his body is now torn and he required more surgery. But even though his sponsor is English speaking, he wasn't able to come with him to the doctor. And so he was at the doctor, he was trying to understand the details of the surgery, and there was no one to translate, tell him what he could expect. Another example of a real serious language barrier. There was a mother from Afghanistan. Her first language is Dari. She's been having a really difficult time finding a Dari interpreter. And she has 2 children. One has just been diagnosed with autism, and she's desperate to either connect with an autism organization or with other families with autistic children, just to get some resources so she'll be able to help her child when they start school. But again, the language barrier is really holding her back. She has said she's been in the States, and she said that it's very common if you're going to an appointment to just call up an interpreter on the phone. And she doesn't think that service is available in Canada. So that is also a huge barrier that she has faced. And finally, just on the last thing about cultural barriers, the focus group participants really want us to know that for many new immigrants or refugees, from their culture, it's extremely hard for some of them to reach out to people, and they may not feel comfortable just reaching out, especially to so many different organizations looking for help. They face so much disappointment over the years and so much people shutting the door in front of them, and they get depressed and then stop reaching out altogether, which is also another reason why just working with one navigator to do all that legwork for them would really, really help them. Next slide, please. Now we're looking at inadequate services or areas where the funding needs to either be increased or reallocated. The first one, services for the blind. Many of the focus group participants who are blind and went over it on our panel of experts is saying they don't need a lot of people with a lot of training. In many cases, it's just being able to accompany them to places like banks, public authorities, things like that. Also, they needing help with shopping, cleaning, and cooking. And they say that sometimes they just need 2 to 4 hours a week of support, but that support is just not available. And they, again, getting a runaround, going to 10 different organizations and asking for help and being told, no, that's not available. One person said that she's lost many of her friendships because she needs so much help. And the friend is like, look, this isn't my job. I just want to have coffee and chat. And if you want me to help you, you'll have to pay me. And yet there's no funding available for that. So that's really a very difficult barrier. The next area that we're looking at is mental health. What we're hearing from the focus group participants is that even though pharmaceutical medication or psychiatric medication is covered by MSP, counseling and therapy, talk therapy is not covered. And it's very difficult to find affordable counseling. One man from India said that he went to a psychologist for about 6 months and got an invoice for $7,500, and he had no idea how he was going to pay for that. So it was a huge amount of stress for him. The other mental health related issue is that there's sometimes an unwillingness to be too honest and open about what they're going through because of a fear of being locked up or medicated without their consent. Next slide, please. So the next area that we're looking at, oh, I'm sorry, inadequate services. Sorry, we're going back to mental health. The previous slide, please. That was my mistake. Right, okay, so we did mental health. The next area we're looking at is caring for family members. What we're hearing is that there is a severe shortage of caregivers and healthcare workers right now because of the COVID pandemic. And it's also difficult for patients who have medical conditions where they need someone with a nursing background. It's difficult to afford caregivers sometimes. Everyone's salary has gone up so significantly while government funding has not gone up with inflation. So it's difficult to afford. And also one person made the point that caregivers, especially unpaid caregivers, are facing so much emotional and physical stress. It's an incredibly difficult job, and they need more help, and they need more rest. So the next area that we want to look at is long waits for medical and disability services. One woman who comes from China says she was told she would have to wait an entire year to get specialized tests for her daughter, who was only 10 years old. At that age, a year is a really long time. Another person said that, after repeated requests every week, making a request for help, after the 2-month mark, she says, well, I'm just going to write to my MP, my member of parliament, and that same week she would get an answer but obviously that's very difficult for someone with a language barrier who can't really write to their NP. And finally, the last example I'm going to offer you is a woman from Syria needed a device. She had a device to get from the bed to the wheelchair. That device broke down and she's been waiting an awfully long time to have it repaired. Is trying to get a loaner from an organization, but doesn't know how to go about it. Again, the language barrier. So next slide, please. So the next area that we're looking at is, the changing government policy. For most of the cases, it's a matter of eligibility. The focus group participants talk about being told that either you're too young or you're too old, or you've been in this country for too long. The woman who said she was losing friends, she just needs help with shopping, cooking, and cleaning, but because she's not an invalid, she's not ill enough to be lying in bed, she's not eligible for any of those caregiver services. And also, sometimes it's a matter of immigration status. The person who does not have permanent residence, who is here on a work permit, when they reached out to WorkBC, were told they were not eligible for services because they're not a permanent resident. And one person who said he was on an open work permit, the immigration status does not allow him to have English as a second language training for free. So yeah, those areas, at least with respect to changing government policy, we may not understand all the details of what the policies are, but the feeling is there should be some fairness and equality. It should not really matter about your immigration status. Next slide, please. Okay, the next area that we're looking at is, oh, I'm sorry, go back, I switched too soon. The other area for eligibility is for PWD or disability benefits. The application process is very intimidating and very complicated. The form is 28 pages long, and the person has to pay out of pocket for each doctor or psychologist to fill out the form, and that's not covered by MSP. Also, we hear that you have to be unemployed for 7 years or more for it to be considered a lifelong disability. And if you're applying for benefits based on mental illness, if you haven't been hospitalized, this man said he only qualified for 25% disability. So he would like to see that changed as well. Okay, now I'm ready for the next slide. So the role of volunteers. Again, as I said, we've heard from people who are blind, do not need very specialized training, just, even virtually just a pair of eyes. For some disabilities, they do need a volunteer with training. But one thing that they're all saying is the volunteer should either be paid or should take their role very seriously. The newcomers with disabilities don't want to feel like the person is doing them a huge favor. They don't want to hear, oh, I'm busy this week, maybe I can help you next week. If they're going to have volunteer help, it should be someone who takes the role seriously, and that's most likely to happen if they're actually being paid, which is provided in some countries. And one participant said that she has a volunteer help her with paperwork, and when she applied for student aid, the volunteer messed up the process, submitted the wrong forms and receipts for student aid, and that semester she lost $4,500. So again, she needed someone who took it seriously, who was able to help her. And another woman who was blind, like we're just talking about plugging into a vast volunteer network. She's an athlete, so she just needs to go when she goes to a gym for someone to tell her, here's the elliptical machine, here are the weights, just to show her where things are. And if she could plug into a volunteer network, find someone who goes to the same gym that she uses, they could work out at the same time, and boom, that would make it much easier. Okay, so yeah, either volunteers should be paid or connected with some kind of referral service. Next slide, please. So the final area about newcomers with disabilities helping each other. This really actually surprised me because there's so much motivation on the part of newcomers with disabilities to help each other. They say once they're settled in Canada, have a place to live, have housing, they're highly motivated to do things like skill sharing, mentoring, and networking with other newcomers with disabilities. The motivation is huge. And, but still, all the great projects that they're coming up with and programs, you can hear it in their voice, like they really want to do things, they would still need the support of an organization. They're realistic about it. It could not happen if they just try to do it themselves. They need some kind of support to set something up. And the other issue they pointed out is that sometimes volunteers do need help connecting with their own communities. When they get to Canada, they don't always necessarily know how to find other people from the same country or speaking the same language or having the same culture. So they do want to reach out, they do want help reaching out to their own communities and either find help or offer help. So the last thing I'd like to say, I talked about the woman from Afghanistan who only spoke Dari and was desperate to find some kind of connection for her autistic children who are just about to start school. So during this focus group, the interpreter actually spoke up and said, I know I'm the interpreter, it's not my job to say anything, just to interpret, but I want to say that just 2 days ago, I was interpreting for a Persian family who had an autistic daughter, and I was thinking of maybe connecting you. So by stepping out of her interpreter role, this woman saw an opportunity to help someone else, another newcomer with a disability, and took that opportunity to help. So that's been my presentation. Next slide, please. That's been my presentation. I've spoken about the problems experienced by newcomers with disabilities. I hope I've conveyed it accurately. Our focus now for the rest of the forum is on practical solutions. So when you're in the discussion and in your breakout sessions, please keep in mind, how can disability newcomer organizations better collaborate? How can we set up a consolidated referral network? And how can we better use volunteer networks to help newcomers with disabilities and better communicate with each other? What changes in government funding do we want to recommend? And what changes in government policy do we want to recommend? So next slide, please. I'm ready for questions.
Thank you, Adrienne. The survey study was really brilliant, and I believe that study has opened up wonderful gaps that exist between already existing services for persons with disabilities and the awareness that they have, or a kind of centralized portal where they can access it. So I would like to invite our panelists now to ask any question, or if they have any comments to make on the survey study or the key ideas that we are going to discuss today with Adrienne and Hugo. So I open the discussion for panelists, and we are open for the discussion till 2 p.m. Thank you.
I have a question.
First of all, I really like to thank Adrienne. It was very, very comprehensive. The report that she had shared was great. Lots of information, and Hugo, your presentation was fabulous. And I was thinking quite a few things, but not many I'm going to speak today. But one question is, like, I know, like for that study, wondering if you have been able to reach out to the for-profit sectors. Often, like, you know, these services, we are more connected with the non-profit sectors and seeking for, you know, support and services. But wondering if there was an opportunity for you to reach out to the for-profit sector.
The way that we found focus group participants, we reached out to newcomer organizations such as Vancouver Local Immigration Partnership, Mosaic, and also neighborhood houses. So we asked them to refer clients to us. It's actually a really interesting question. We didn't really reach out to anyone in the private sector, and that's a good idea, perhaps for future, you know, to kind of expand. And all the focus groups were only held in the month of October, and we only had 5 of them. We only had time for 5 of them. So there was an average of 5 people in each focus group. So we're looking at really only 25 people. If we expand that and sort of get like a larger pool, including not just the private sector, but other areas, we could find out, you know, different things. Is what I presented just seems to be the biggest issues that, you know, people were identifying.
Thank you.
Thank you, Koyali. So anyone else would like to share any questions that they have on the mind? Yeah.
Thanks for sharing the results of that project. I think it was really interesting to hear, having done a focus group ourselves and interacting with a lot of settlement workers in the sector. I think as working for a disability organization, it was easy for us to assume that we didn't know anything about this, but when you hear it reported back, you realize that I think one of the biggest things the disability sector and the settlement sector have in common are the shortcomings of the services designed to support that sector, the wait lists, the nonsensical eligibility criteria, the lack of services available. And I think that's certainly what we learned in trying to come up with a welcome guide for newcomers with disabilities is how do we provide information that equips people to better navigate the system when the system itself is a bit broken. And I know I struggled with some guilt about saying, well, we're really equipping you, or we're trying to equip your settlement worker to better understand, like, what is it like wheeling a wheelchair in the snow when you've never dealt with snow before? And that kind of like pure knowledge that we know as a disability organization, when we realize you haven't had the ability to get your wheelchair repaired in 2 years. And so even your equipment doesn't work. So I think that's what makes it hard, but I think we have more in common than we realize. I just don't know how to fix that.
A wonderful insights, Jocelyn. I believe the survey has made us realize that we are well aware about these gaps, but it's like, it's at the back of our mind, right? We are not paying much attention to do anything for it, right? We are not doing anything to fix those kind of issues. And the gaps that are existing really need our attention, because people who are already migrating from one country to another, they are going into entirely different, geographical area, entirely different cultural areas. So apart from that, they're having additional layers of barriers added to it. And that makes things more complicated. Thank you so much, Jocelyn. Anyone else would like to share their ideas or comments? Thank you.
Thanks so much. So I work for the Family Support Institute of BC, and we support families who have a disability, any age. You don't need a diagnosis to call us, and we don't have a wait list. And so I want to talk about the value of peer-to-peer support, because that's the core of what we do. We matchmake a family that's looking for some support with our group of volunteers, and we find another family that can connect with them, help them navigate things. And honestly, I think the huge value of that is just the emotional support, is being able to connect with another family who gets it, who's been there. Everyone that works with FSI has a family member with a disability. I myself have a teenage son who has a rare genetic disorder. And when he was born, it was rare. No one knew anything about it. It was very, didn't get a lot of information from doctors. So I figured out quickly that the people that were going to support me were going to be other families who had been through the same thing, who were maybe a few steps ahead of me along that path. And that was really empowering for me when I felt terrified and, lost. And I'm a newcomer as well. I'm from the States. But even, obviously my English skills are just fine, but trying to understand how the system worked was not easy. So finding other families were sort of the best way that I was able to get information and to get sort of real information, right? Because there's things that doctors will tell you, social workers will tell you, or things social workers won't tell you, but families will give you the real deal, right? They'll give you the real skinny of how it works, how they were able to do some maybe workarounds to qualify for a program. So there's really a lot of value in that. And I think that's probably one of our best ways is to build this community of each other, guiding each other, whether it's through cultural lens or language lens or a diagnosis. So.
Thank you, Heather. Anyone else? Yeah, sure. Thank you.
It's very interesting to see that the challenges and the difficulties of newcomers with disabilities are being discussed on the table between the disability sector and the settlement sector. Definitely, there's a huge gap. The issue of newcomers with disabilities are almost absent from the agenda of the settlement sectors, including planning, including funding, and also leadership. So yeah, so I'm very happy that we are discussing this today. And I just want to share this with you. 9 years ago, I was a newcomer myself. And although I spoke English, but I faced a bunch of challenges. And I was sharing with Adrian that I wished I had this magic worker who could navigate me with all the resources. But unfortunately, there's no magic worker. And I had to figure it out myself. I had to navigate the system myself. And of course, it comes with a bunch of challenges. So thank you.
Very true. And I echo that voice of yours. And I really congratulate Adriana and the whole team. We have assembled here to plant the seed by being vocal about those gaps and try to find out real practical solutions, because somewhere one of the other of us, we have been into those spots. And being an immigrant, even if we feel like we are not having any kind of physical disability, there are many challenges at various layers. So thank you so much. We have 1 minute more if anyone would like to share their views.
Thank you. So I'd like to add my thanks too. And I'm glad that you mentioned leadership, because I think that's what we've got here, some really great leadership happening to start a really important conversation. My name is Diane Willman, and I've been working in the settlement sector for about, well, many decades, and worked for 17 years in neighborhood houses doing settlement work and other things. And I think what I've learned about neighborhood houses is that they're really great places to convene and to connect people with community and to help with a sense of belonging for everybody. And while I think it's really important to identify the gaps and the problems, I think in this room and in the virtual room, we have a lot of assets in terms of knowledge and relationships and potential networks. And what you're doing here is bringing that together so we can actually make a difference. And I think all of us have great ideas around policy changes. I hear a lot in the research and these focus groups around the power of connecting with community, volunteerism. All of these things are happening in neighborhood houses. So I do think there's a role here for these organizations. And I also just to say that the consortium of neighborhood houses in Vancouver, Little Mountain, which is where I work now, leads that consortium. And we do have some resources over the next 18 months to do trainings or to bring awareness or to start developing more of these types of conversations. So I would say that's something we could totally explore. Thank you.
Thank you so much. So we will be moving ahead to our break time. So welcome back. And we have Jocelyn and Jana to share with us. Yeah, so I will hand over mic to them and then we will move on to the next part of our forum, the main part discussion. So yeah.
Thank you so much. Here she is. Give me 1 second. There's never enough bathrooms.
Just on the topic, I know there are probably several organizations that are developing things for newcomers with disabilities and want to make it available. My question to all of you is that how can we as organizations make all these wonderful resources available to each other? Do you see it as having them all listed on a website or on social media? If it's okay, I'm going to share my screen because I also received an email from, oh, I can't share my screen. We also received from the Plan Institute a disability resource and supports for newcomers to Canada. And it looks great. I wish I could show it to you on the screen. But again, these are great resources. We want to be able for anyone to access them. So I guess in the discussion and in the focus group session and the breakout sessions, how do you see that happening? Do you see creating like a website just about newcomers with disabilities, or maybe something on the Disability Foundation or the Network Building Project, a website just for us? How are we going to share these wonderful resources?
Wonderful. Oh, sorry.
Just briefly, since you asked, I know Kayali mentioned that her organization is working on something to collect those great resources. Our experience at Spinal Cord Injury BC and our information resources is that you want to put the information where people expect to find information. And that seems like a simple thing, a truism, but for example, if you are creating accessibility information for getting into, buildings in Vancouver, you put it on Google Maps, you don't put it somewhere else. Or if you do, you really need to mark it so people know where to find it. And so for us, our plan is it's a rich text PDF document that will be available on our website, but we really want it to live in the places settlement workers are most likely to use it. Because for phase 1, we weren't able to make it a translatable or it's not translated, but it will be. And so we focused on what would be useful for settlement workers with some handouts for newcomers. And it'll be online, it'll be something that can be Googled, but you kind of need to know it exists to Google for it. So we really want to work with more settlement organizations so we can at least tell you it's there and get feedback and make it better and really see it as a living document that we all have a stake in and we all can use the information in the way that works best for the community that you're serving. Because it's a lot of information, and we know that that's a downfall of it, and we want to find better ways to make it, helpful.
Hi, Raj Gill. I know I've been quiet this evening or this afternoon. I've been tucked away in the corner here, but I am still here. Just to echo what you've said, Jocelyn, and kind of expand on it is, I also think we need to bring awareness within each organization, and that only comes by forming together maybe once a year, maybe getting the representatives from each organization to kind of meet so we can see it face to face and have these discussions like we are today. That makes it real for me. And then I can go back and cascade information down and create a network, right? It's fine that we have the online platform and a place for people to come and visit online, but what happens when they actually come into the doors of the organization? Right? It's that awareness piece that we need to have, that kind of knowledge, working product knowledge of what's out there. And that only comes by forming together, right? Whether it be once a year, annually, or, whatever we feel the need may be. but not only does it spark conversation, but it also kind of, you know, troubleshoots some of the issues we may be seeing throughout the year, right? And that's usually kind of where we hit our roadblocks, is when we have these great ideas and we get an online platform or we get documents and we get resources, and then they kind of, we're all gung-ho for like 3 months, and then 4 months, 5 months down the road, you know, no one's using any of that, right? So to keep it fresh, I think it needs that kind of boost once a year, you know? And yeah, that's about it.
And I just wanted to add to that one of the things that we just faced from the beginning is the language barrier. So my first thought with all these, I want your contact, and I want your contact, and I want that guide, and I want, you know, like a lunch and learn with everybody at Mosaic, and just do that. But when a person is a newcomer, how can they read that in English, right? So we have to start reaching out to their communities. Not always is about funding. We can reach out to the communities, to the consulates, and say, hey, this is to benefit someone from your community. Can you translate this for free? Oh, can you do that? So and we can also reach out to Can at the airport. Can you have this? If you see a newcomer with disabilities, can you give them this toolkit, including, you know, as soon as you arrive, it's going to take a year, but you should apply for benefits. You should go over here. So just my 2 cents on it.
Thanks, Hugo and Jocelyn and Raj as well. I think it's a very real, almost a reality check that we are talking about today. So from the VLIP, Vancouver Local Immigration Partnership, it's a very big partnership with many stakeholders. So we have 40 plus just within a 1 year, and then it will be expanding more. One of the values of the VLIP is big time is on equity. So how you see equity in the different lenses. So accessibility is one of the areas that VLIP will be embedding. So on that, in that whole stakeholder group, we have like huge nonprofits, like people, settlement agencies, and other nonprofits, for-profits, governments, 3 levels, and then the few other may more. So we are going to create very shortly, our strat plan is ready, and the operational plan is also working on. So one of the areas that we are going to build is called Knowledge Hub. So Knowledge Hub will be, yes, there will be digital resources on the knowledge, and instead of like creating one on our own from our side, we are going to not duplicate. So existing resources, we are going to really be a huge, strong research and put most of the stuffs on our website. But if you are on the table, I think that would really help even to have your voices in the VLIP, and then work towards what you know, Raj was mentioning, not people to forget. And then maybe once a year, you know, gathering like that, big collaboration gathering, and then a few other things that VLIP can be able to help and support. So just wanted to put it out there. And even if you wanted to join VLIP, I can share the website and go from there. Currently, we do not have a huge, strong voice from the disability sector on the VLIP table. So I would really welcome everyone who wants to take a look at the website, get more information, and join in the council of the VLIP. But yes, I guess we're committed to do some work around this area. Thank you.
So thank you so much. I believe I also have an idea to share. That people who have assembled here today, coming from different organization and committee partners, they can share some after resources to Adrienne so that she can, you know, she can be the hub of those sources, as well as she can share it back to all the participants. So that would be one of the ways that we can take away the information. Yeah, and one of the way the networking would be productive, for sure. So without wasting, or I must say, without delaying, to move on to our next component, that is discussion. So we are supposed to focus upon the practical solutions to the three major challenges that come up from the focus survey. The first one, how we can collaborate better for accessibility of the information. Second one, what changes we can recommend for government funding and what changes we can recommend for government policies. So keeping in mind these three questions, I would request that we will split the whole time session into 15 minutes, where for each 15 minutes, we will be discussing these questions one by one. So initial 15 minutes, we will be discussing about the ways we can collaborate better to make the information more accessible. And because we have participants from in-person as well as online, and I would like to split this discussion in an alternate manner. So there would be one person who would be sharing his or her ideas in person, moving on to another person who would like to share from online platform. So anyone who would like to dive into the discussion, just raise hand if in person, or use emotion or emoticon or raise hand from online.
We have one of our panel of experts is online. Her name is Annie Wei, and she's been waiting for a chance to speak. So I'd like to open it to Annie.
Yeah, sure. So.
Annie, you're muted.
Hi, hello everyone. My name is Annie. Can you hear me? Great. My name is Annie Wei. I have a few roles. I'm a caregiver, main caregiver for my husband who has a terminal diagnosis and also become disabled from the diagnosis. And also I volunteer for ALS Society of BC in the past 4 years. And I also work full-time on a homeless shelter project with an innovative modular solution. So I kind of covers a little bit of different social issues in my career and in my personal lives. So today I would like to just share what I have experienced about the whole disability support for newcomers situation. That I think the biggest issue or challenge is get people to motivated to navigate the systems eventually on their own, but they needed a lot of help. Speaking from my own experience, I moved in and out of the country for a few times. The most recent move from the States, but the whole healthcare system is quite different. Even if I don't have any language barrier in this case, it's still very difficult to navigate the whole system. So I encounter a lot of people who are born and raised here, and they still don't have a clue how to navigate the system. It's really challenging. It's not like a man-made barrier. It's just, I think it's a lack of coordination and lack of consolidation of services for people who already have a lot of barriers in their personal life. So I guess my point is, I do think it's a great forum to bring us together to talk about this challenge. And I do think the synergy we have gathered today here could benefit a wider circle of people, not just the newcomers, because the ideas that come together here would help newcomers for sure, and also would help anybody with a disability with a barrier to access anything they want to have access in terms of education, social services, personal lives, entertainment, anything they want to have to enjoy a full life, regardless of disabilities or not. That's what I think. Good to see everyone here.
Thank you so much, Annie. And yeah, so we would be moving on to our discussion part. I have a request that please mute yourself when the person is speaking so that other voices, they are not going. And yeah, so I would like to start the discussion from in person, and I would also request our online participants to raise their hand after 4 or 5 minutes so that they can be the next person whom I can hand over the discussion. So yeah, the forum is open, and Anyone who would like to raise their hand? The question that we are discussing in the initial 10 minutes is about collaboration, how we can collaborate better to make the information more accessible to the newcomers. Yeah. So anyone, please raise your hand.
I just, hello, yeah. I have one idea. I've been thinking as I hear of so many experts, we could do joint trainings. I think that would be very helpful. Have same amount of settlement workers as agency workers in a room and have one case or two cases and just see the both perspectives, and then we can come out with a common solution. I think joint training would be very helpful, and I'm in for it too, please. So.
Yeah, that's a wonderful idea, I believe. Okay, thank you. Yeah, so that's a wonderful idea. And I'm also noting down the points, and I will also request you all to make a note, because when we will be getting more closer to the closing of the forum, we should be having a good list that we can keep working upon and take them into further direction. So anyone else from, yeah, online forum, Yuli?
Hi, I want to ask if there is someone who speaks Spanish.
Yes.
Yes.
Adelante, Yuli.
Mi nombre es Nidia, Juliana es mi hija, ella tiene pérdida auditiva.
Vamos parando para que lo pueda traducir. My name is Nidia. ¿Tu nombre es Nidia o Yuli?
Nidia.
Nidia is, and her daughter is Yuli, and she is deaf.
Yo hemos batallado mucho, quisiera encontrar un lugar para Juliana para que aprenda las señas en inglés y tampoco no las tiene muy definidas en español, sabe muy poco.
We've had a lot of trouble finding a place where my daughter can learn sign language, not only in English, but also in Spanish, and she's not proficient yet.
Y pues ella tiene el implante coclear, también no sé a dónde ir para que le calibren su aparato. No sé si aquí alguien me podría dar alguna información sobre esto.
And she has, I don't know how to translate this cochlear, do you say that? Yeah. Yeah, she doesn't know how they can help her service it. So if somebody could guide her, she would greatly appreciate it.
It's an internal hearing aid.
Yes, yeah, internal hearing. Thank you. Thank you for that. Yeah. Adelante.
Ya es todo. Muchas gracias.
That's it. That was everything.
So anyone here can help Yuli? Okay, I believe no one is present here for the time being, but yeah, we have noted down your request, and we will see if any resource we would come across, we will definitely share back with you. Thank you. Who else would like to be the next person from in person? Yeah, thank you.
Hi, I'm Forrest. I'm deaf. and I'm here on behalf of Greater Vancouver Association of the Deaf. So as you all here are hearing people, and so recently there's 15 deaf people who moved here from the Ukraine. Sure, let me just start again. Hello again, everyone. So I'm Forrest, I'm representing GVAD, and I'm a deaf person. So there are over 5,000 deaf people in BC, or people who use sign language, I should say. So more and more deaf people have been moving to the province and been contacting me, and a lot of the time I don't have the answers for them. So again, any resources that can be shared with me from your different organizations that I can share with the deaf population, especially for the newcomers in the community, that would be amazing. So I'm here to network with all of you.
Thank you, Forrest. So anyone would like to take a lead with the resources that they can share to serve? Yeah, thank you.
I know of an organization called Wavefront, and Wavefront deals with cochlear implants and also deals with people who've lost their hearing later in life. So that's just the one that springs to my mind at the moment.
Thank you, Heather. I appreciate that. So who would like to go next from our online participants? May I ask Maya to unmute herself? Thank you.
Hello, everyone. I've been really enjoying the panel today. I'm pretty new to this intersection of work, so it's really great for me, just as a reminder, to always be expanding possibility for this specific intersection of disabilities and newcomers. Just in response to that last comment, United Way does have the United for Ukraine initiative, which involves connecting Ukrainian refugees to different services, from housing to childcare programs, and we have a lot of translation support available. So I'm curious to go back to my team and see what is in place to help people with different sensory experiences. So I'd love to let you know about that. I was just wanting to bring up BC 211. There's translation available in over 150 languages for different kinds of research, different kinds of resources. I'm not sure what the actual experience would be like for a newcomer with disabilities to access that service in reality. So I'm also curious about what that is like. However, that BC 211 is a huge, it's a huge sort of offshoot of United Way now, and it is well resourced. So I'm wondering about possibilities for BC 211 to work with folks in this room more. Perhaps there could be, just more focused intention around receiving newcomers with different disabilities. So I would love to connect BC 211 folks to people in this room. And also we have iVolunteer, which is a volunteer platform. And I myself have used that volunteer platform to get different forms and things translated, and it's been a very quick response. So yeah, I'm curious about what possibilities could happen there, and would love to connect more after this as well. So I will send an email to Adrian.
Thank you so much, Maya. I believe that would be really helpful for us. So we have kind of 2 minutes more to discuss more upon resources. So I invite anyone from our in-person participants if they would like to share.
Yes. So I believe one problem that at least myself, I faced when I came to Canada was where I can find the resources. If we can create like a website, design like a centralized information, like a bank of information that if you just Google disability, I don't know, resources in Canada, just that this would be the first link that Google will bring up. So I believe we need something like that because we are talking about collaboration, because there are so many places, services available, but here and there and different names, different acronyms. So for me, when I came here, because of the cultural and language barriers, I even didn't know what is the right word to Google, to look up. So I couldn't find the right answer because I didn't know the right question. And second, something that I really faced, and I have many clients pointing out, we are isolated, we are lonely, we don't have family members here, we don't have friends, we lost our group of support. I believe we need more community engagement activities. I've been asking around for 2 years or 3 years since COVID started. I got an idea about having a gathering center, disability gathering center, like inviting people with disabilities to get together, like for just like a cafe, restaurant, something like that, just for gathering. You don't need to have intake forms. You're not a number. I'm not getting fundings because you're just coming here. I just want you to make friends, to just hang out and talk to others. Don't feel you're alone. You're completely included. The place would be accessible. So I've been asking around to get some help for writing down the business plan and getting fundings and having a team of support. So I wasn't able to do that, but if anyone know how to do it, I would appreciate it, because we need people with disabilities to get together. We can share information. Yes, maybe I don't know the right question or right answer to something. Somebody else that has the same experience as a person with disability, doesn't matter if they are Canadian or not, pain is pain. And I totally get it because I have multiple disabilities and I'm an immigrant. So I believe we need something like that because we are so isolated. It's not even enough to train people or get together once a year. We need an action to find out how we can make it happen. Thank you.
Just say something. Oh,
Sorry, I know we just have a minute, but I just want to plug FSI's searchable database. It's called Find Support BC, and it's a database of all of the resources that exist in the disability arena in BC. It's searchable with different drop-down menus based on region, city, age, disability, and it lists, like say if you had a child with Down syndrome and you lived in Burnaby and you were looking for how to access supported child care, you would find those in the search criteria. So we've got over 5,000 resources. If you don't see your agency in there, you can ask to be added and, say like which areas that you'd like your agency or your services to be added to, because we're always expanding and trying to make it more user-friendly and more comprehensive of what's out there. So it's way better than Google because, Google is so broad, and half the times you get hits that are, agencies in the US or UK or, so that's why we created findsupportbc.com.
One of my challenges is that,
Yeah, I just wanted to add that for me, this is a great example of resources that exist, people that need them and not the connection. And I really liked what Raj said about relationships. And I'm also aware of, and I'm sure it's true in the disability sector too, how stretched workers are and how little time and how people want to know and they want to learn more, but they're trying to figure out, well, how do I do that while I'm still doing my job? And so for me, what I think is really critical to be able to have meaningful collaboration is piggybacking on what's already happening. So yes, sometimes it's great to start something new, but also how can we look at what's already happening in terms of collaboration within those sectors and then bringing that kind of collaboration together so that people aren't having to choose between this piece or that piece, that they can come and that they can actually learn and be able to participate in both, break down the silos really, yeah.
I think I'll add on that exactly what I think instead of duplicating the resources, how to make it more accessible for people and creating. So VLIP is actually going to create call as a community of practice within the members and how we can work together. So that will be one of the ongoing or very recent in the operation plan. Thank you.
Thank you. These were really wonderful discussions and ideas. Definitely we can dive in more deeper when we will be having breakout sessions. So moving on to our next component, that is we are going to discuss now about what changes we can recommend for government funding to serve newcomers with disabilities more better. So yeah, I open the discussion again, and I will request anyone from our online participants if they would like to share their ideas with us. Thank you.
Hi, this is Annie. I'd like to say something about that topic and invite others to jump in to share their ideas. I think that in order to attract more government funding to support this challenge, then we need to show the organization that's working on this issue that come together today may start a smaller scale experiment by saying that any ideas that come up from this forum, for example, have a navigator type of role, have a consolidated service kind of role, then how do we make that happen in a smaller scale and improve the effectiveness and the reach of that service with this type of role? And then we can go to the government to get more funding based on that funding process. It doesn't have to be a wider scale project, it can be a smaller one to prove that it's actually useful and compare with before and after that kind of study that will help people to understand the effectiveness and the necessity of overcoming this issue. And in my understanding, a lot of newcomers to Canada, they have experienced different government and political systems. They probably don't understand where and how, or even if they can, go ahead to ask for help. That's a significant barrier we need to overcome. And if we overcome that barrier, then there's another barrier of navigating the multiple organizations that actually provide the services. I was surprised to know there were over 200 organizations and the government agencies provide some kind of support for people with disabilities. I probably haven't touched a quarter of, like a fraction of them, but I think I'm already having a lot of support through the organization I'm in touch with. But what if the organizations can work together a little bit more just by trying a little bit and make this experience much better for newcomers? And then we can show to the government that it's actually working. And then we probably need more support to make this available at a larger scale.
Thank you, Anne. I believe this is a wonderful idea, and it's similar to the resources are already existing, but it's just how we can collaborate better. So yeah, anyone from in-person participants would like to come up with any idea related to government funding?
Thanks, Anu. This is Helene Boyd. I'm the Executive Director of Disability Alliance BC. I've been really jazzed with all of the discussion so far today. And I still have to take some time to really think through everything that's been said, and I look forward to the breakout session. So my understanding that on a federal level, There's IRCC that gives funding to newcomer service organizations. And then also on the federal level, there's ESDC, Employment and Social Development Canada, that has the disability portfolio underneath it. And they've been reaching out to disability organizations across Canada to understand more about what their navigation services are, because there is definitely a need for broader navigation support across the country. So Disability Alliance BC offers a number of services, and when we can't provide that service directly, we give information and referral out to other organizations. But as we can see from the experiences of people with disabilities in the focus groups, as well as just from our own client experiences, as well as that they truly want to have a stronger one-to-one support in which they get followed up with after they're given information to make sure that they go through with the process, and that it's not just information that's being given to them. And that can be combined with peer-to-peer support as well. But I'm just thinking about like further capitalizing on the ESDC's desire to improve navigation services for people with disabilities across Canada, and to incorporate the needs of newcomers with disabilities inside that. Thank you.
Thank you so much. So I would request any participant present online, if they would like to share any kind of area that they would like government funding to be more in focus. Anyone from our online participants? And if there would be none, then I will switch to in-person. Yeah, there's one. Thank you.
Hi, everyone. I'm Ruth Warwick with the Wavefront Center for Communication Accessibility. When we talk about government funding, I think there's different levels of government funding needed. And that would be to the organization providing support for the collaboration and networking among all of us. And then at the individual level, I know in our agency, we're dealing with right now 6 deaf persons from Ukraine, and we have the expectation of another 10 in the next few months. And they all have higher costs due to accessibility, and higher costs because of the barriers to not having transportation, housing, barriers to employment. So they need greater support than typically other newcomers. And that's a case that we'd be happy to help you make to the government. I think that this is a good collaborative group to begin to address these issues. So thank you very much.
Thank you, Ruth, for highlighting this area of need. Yeah, so I will pass on mic to Jocelyn, and then
this kind of goes to Sam's point from a little while back, but also to this question. After we sort of came up with the idea to do a toolkit, one of the components that we actually got funded through Vancouver Coastal Health Community Investments was to do a toolkit and a focus group and sort of an in-person social kind of a resource fair. Like we would call it an SCI forum, but because we're part of the SCI Community Services Network with many of the organizations here, you know, our sort of idea was that we would, you know, bring everyone out with a bunch of different things to try in the Blesson Center with translators and information and that sort of thing, because those types of in-person peer support, like opportunities to try new things and get to know people is sort of what we do. And I think with that idea, we were trying to learn how to do it for newcomers too. And unfortunately, I think at that point didn't have the skills and resources to do that properly. And the partner we were working with didn't have a high volume. So it would have been a very small event. So my comment to Sam's point and to other sort of folks in the settlement sector is I think there are opportunities to work together on those events with groups like Spinal Cord Injury BC who do peer support. We do fun, interesting in-person events, and we need to learn from you how we can best welcome and support and make that a meaningful experience for newcomers alongside all of the folks with disabilities who want to share that information and share their knowledge and learn from others. And on the note, at one of VCH's, at the Smart Fund sort of anniversary conference, I co-presented with a person from a peer support program for blind and low vision folks. And it just reminds me that I think there are peer support groups that would love to be better at supporting newcomers and having those isolation breaking events, having those fun, engaging events that build those connections that then hopefully help newcomers find that sort of supportive community here and help us learn how to better support them. So I agree with a lot of the suggestions, but I do think there's a lot of opportunities that in existed funded programs that, you know, we'd love to learn how to do it better.
Thank you. So one of the problems, again, I faced when I came to Canada, I had to wait 1 year in order to apply for PWD. So I am blind. It doesn't matter if it's 2016 or 17, I still am blind. So I had to, you know, like live with like almost $150 per month because I had to pay $550 for rent, $80 for my phone bills, and only $150, $60 for everything else. So 1 year I had to wait. And then after I applied, it took me about 4 months maybe to get accepted. So this is one thing I believe government can, you know, review to change it. And second, it's about housing. Most of my clients, they have housing issues because the PWD amount, it's below poverty line in BC, and they need to reevaluate that. You know, it's very low, and it's included shelter, food, anything, like everything, not even $1,350. So I believe that's something also they need to change it. And housing, again, because it's so expensive and unaffordable. So many of my clients, like she's 71 years old, she's paying $1,050 for rent. And I don't know about her bills, but just imagine how much would, you know, she has to survive, you know, every month for just maybe $100 something, $200, and she has to pay $100 for her medications because it's not covered. So this is just an example. And we need more voucher plans or credit voucher housing, or not only BC housing. Everybody knows, you know, BC housing takes forever to get accepted. So we need more alternatives, affordable housing, low income housing support. Yeah, and I don't want to talk about employment now. It's a long story.
I just want to comment on the government funding. I know, like for most settlement sector, like they apply for funding through the government. I think the newcomers with disability issue is not reflected through the proposals that we are submitting to the government. And I would just say, like, using the disability lens in all our programs while applying for funding is not really reflected, and it's not considered as a priority. For example, like using the disability lens in the workers program or employment or settlement or housing, like this, it's not well reflected as it should be. So this is my word to the settlement organization. Consider us as a priority, because it really matters for us to be included in all these programs.
Yeah, 25% of the society, right? 25% of the society have a sort of.
Yeah, it's just coming from WorkBC and working in the current labor market with people with disabilities, some which are newcomers, some are just, residents of Canada. And to expand on what Sam said, yeah, the PWD benefit does not cover barely anything. Like, I mean, they are like way below the poverty line, especially now with inflation and the rents being, it can be upwards to like $1,100 for a 1-bedroom suite in Surrey. That's nothing, right? When you consider these people are making about $1,500 on average, if they're lucky, per month on PWD benefits. And yeah, I know there's a new bill, the bill C-22 or something like that, which gives them some tax benefits, but that's still not enough. Where I like to see a change is in the amount they're allowed to earn per year. Because a lot of times I am able to place PWD clients in great placements in an employment setting. So much so that they're starting to thrive, and they're getting offered more shifts to work to make more money, but they're afraid that it's going to affect their PWD status. We know that, PWD, if you've been on it, they'll allow you to earn a certain amount, and then whatever you earn above that, they'll kind of claw back on it. And that's just ridiculous, right? So they're not given any opportunity here to, potentially earn more. So they've done everything you've asked them to do. And they've applied for PWD, they found employment, and now they have the opportunity to make more money. And at this point, they're saying, well, no, you're capped here. So what does that really do? It just keeps everybody right at that level, which continues to create that stress, right? And now you're going to see that flow over to mental health. You're going to see the stress coming out that way. And that's just going to end up costing more for the ministry and the government at the end of the day, supporting individuals with that. So this is on the verge, I feel like, because I see it daily and with each and every one of my clients of how much it stresses them out. And I could just see it, it's about to burst, and that is my number one thing on my priority of trying to figure out creative ways for these individuals to make money legally.
Thank you, everyone. I believe you have raised wonderful points, practical, frustrating, positions that people with disabilities really come in. So I would like to share that we have time constraints, so I will give opportunity to Hugo to share any idea related to government policies that he can share with us. Thank you.
Yes, I'm pretty quick, but I agree with that settlement agencies, we have to look inside and change the way we're doing things to have that disability lens. I'm not the expert. Chantel, who's here, I'm putting her on the spot, but she's the expert. She's the senior manager of that. And we're working very hard, but it's not easy. I mean, Sam and I just discovered that Raj and his team had already serviced hundreds of persons with disabilities. And within Mosaic, we didn't know that was happening, right? So we have to rearrange how we count our services and how we're asking our settlement workers to also do the intake. And that takes a whole process that has to be acknowledged, has to be understood. I would say we need the whole settlement agency to go into training as to how to approach persons with disabilities, how to service them to the best of their ability. And that's one. And the other one, another thing that we can do together is that because our funding and our functions are different, like I heard the person from WAVE, Mosaic is the lead in coordinating the Ukrainian task force. So I'm not, also there's another senior manager, but glad to put you in contact because there's many resources and there's where we can partner. You can partner servicing the disability and we can do the other part of integration into the society. And I think that can be very positive.
Thank you so much, Hugo. Yeah, we have one more participant.
Maybe a good idea, like what Hugo's saying. We have a disability representative from each organization come together. And then perhaps we'll be able to advocate as a group, as a team. I'm happy to be involved in something like that. So, you know, all organizations, of course, have able-bodied people, but why not a disabled representative from each organization to advocate for us? Have, you know, equality in who's representing these organizations. And then perhaps we'll be able to get better funding and better resources if we come together and make a team.
This is really brilliant idea. And I think that brings you know, people more close to the organizations, right? And they feel more connected to the person who is actually serving them. So it's really brilliant idea. I really liked it. Thank you so much. So we will move to our break time now, and we will be back at 3:30. Thank you. Please take your seats. The break time is over.
And we'll let you enter one of the breaks.
Thank you so much. So before we move into breakout rooms for discussion, please listen carefully to the instructions. The breakout discussion time is a chance to brainstorm ideas to serve newcomers with disabilities based on the major challenges experienced by them as shared by Adrienne in her presentation and the focus survey. The key areas of your discussion should be focused on either one or more of them as displayed on the screen. That is, how can disability and newcomer organizations better collaborate? What changes in government funding do we want to recommend? And what changes in government policy do we want to recommend? Keeping these three key questions and challenges, please focus the discussion of the breakout session. The session will last for 30 minutes. Each breakout room will be led by a breakout leader. The panel of experts present today will be the leader in each room. So the panel of experts, being the discussion leader, is responsible for keeping the participants on the track to these three key topics and is supposed to give them reminder in case they get off the track. Also, panelists, the participants will be manually assigned by facilitator or Graham and his counterpart. Please keep an eye on your chat box since I will keep giving reminders after every 10 minutes so that you are also going with a time aware flow, and before the closure of breakout room, there would be 1 minute reminder. It is highly recommended to be respectful during the discussion, and after that, we will be moving on to the final discussion. So there will be some breakout rooms in person and some breakout rooms online. So yeah, I believe people have already arranged their tables. Thank you so much. So I will be sharing who will be the in-person panelist for the discussion here in the room. Thank you so much.
The time is up for the discussion, and now it's the time that the leading representative of each breakout session or each breakout group will discuss the summary points of the discussion. So I will keep on moving from one table to another, and I will request our leading panelists to summarize the key points of the discussion. Thank you so much. So I will hand over. We are having two panelists here, so who would like to take the lead? Oh, three.
I realized we didn't have enough time to talk about everything that we wanted to, so I'm sorry for interrupting all the great discussion. So from our group, we got through 2 of the questions, so I'll try my best. In terms of how we can collaborate, the points I have here is that we need to form cross-sectoral relationships, and our funding streams tend to be very separate at the moment, so there might need to be a bit of advocacy with our funders regarding cross-sectoral funding for newcomers with disabilities. We also understand having a website where there's all the resources, even when translated, isn't enough, because we understand that newcomers with disabilities want a physical person to help them, and they don't know how to navigate the system at the moment. We also understand that in the immigrant services sector, there is the umbrella organization AMSA, but the disability sector doesn't really have such an umbrella organization, hence why we created the network building project. So we definitely want to connect more with AMSA and understand their model. And in order to support individualized approach to the services that are available for people with disabilities. One possible action item is to do like a train-the-trainer or cross-sector feedback when each of our organizations has our initiatives, like say a disability organization has an initiative, can we then share it with newcomer organizations so we can get feedback on that perspective? For funding, there needs to be funding that has a shift in providing financial incentives for a collaborative approach. So at the moment, many of us may feel that there's a competition amongst organizations for funding, and that might be a bit of like an advocacy with funders to allow for a more collaborative approach. In terms of the idea about like a holistic navigation type of system, there's also social workers who are usually attached with health authorities. It would be really great if there were social workers that could assist newcomers with disabilities who have lived experience, so that peer-to-peer approach. But that's just one example. Like there's many ways in which you can have holistic navigation. It's a lot of demand for our nonprofit staff to get all of this information and resources and provide all this information and support to clients who are already, like our staff are already feeling quite full capacity. So when it comes to funding, we have to think of like actual dedicated personnel for things like this as well, because we don't want to overburden our staff. We had a bit more about questions regarding welcome packages to newcomers with disabilities and how both of our sectors can come together to improve those welcome packages. But really, we understand that building relationships with newcomers with disabilities is really important in order for them to trust us and to really help them. And then lastly, for policy, I just wrote something on my notes, but I didn't actually talk about it during the discussion. DABC on everything that's wrong with the PWD system. And it would be really great to get newcomers organizations to be included on that, because you have your own perspectives on how the PWD system really marginalizes newcomers with disabilities. Thank you.
Thank you so much. It was really informative summary. Moving on to our next table, I will hand over mic to Koyali. Lots of notes.
I guess we had started a very good discussions, but mostly our discussions revolved around collaboration, funding. We haven't had a lot of chances to talk about policies, but I think the emerging trends in the conversations was from a one-time newcomer and her struggles and that she faces, and then she was sharing what would be the best things to do. So let me start with the first question on collaboration. I guess a lot of people did mention like VLIP, Vancouver Local Immigration Partnership, which is, I think, well positioned, existing. It already had the stakeholders, when new stakeholders come and join, and they have this equity lens in their work they do, as forming a subcommittee within one of the working groups with the VLIP that can be as a part of helping with the funding for the organizations, like a partnership-based funding. Other one is also advocating for the policy change, like influence policies. So for the disability sector as well. So I guess that was one of the things that overarching theme that came out. There was also talk about a model called with the migrant workers program funded by the ESDC. So it's a great network with already like quite experts in the field of the migrant workers. So that model is a great collaborative model that can be able to be applied and replicated. And the other one is the, I think you mentioned like the direct care table in the VLIP event, and then having the supervisor overseas. So that's, she has also a great model that she did explain. The other one with the funding, so as I mentioned, collaborative funding. So instead of working in silos, like being partner with a couple of agencies and apply for the funding. Because for sure, the government sometimes, most of the times, I guess, they look into the proposals when it is having that collaborative approach instead of one solo agency is applying. Right? So that's where, and the tapping into the private sector for funding. So basically diversifying funding, that's a good approach. So yeah, collaborative partnership and diversifying funding is a great approach. And more advocacy. Regarding the policy, I think there should be needs for systemic, there is called systemic ageism, which was actually talked about here on this table from first-hand knowledge from the one-time newcomer. So that needs to be shifted actually. Another thing is also many agencies, those who are serving newcomers are not well versed for referrals. Maybe the staff, especially the front line and especially at the people at the reception. So that was one of the, the loopholes, the gap that the one-time newcomer faced here on the table. The other one I wanted to add here, I think BC Human Rights, actually Office of BC Human Rights, does work on very focused on the disability sector. And currently they have a campaign out. And I had previously worked with them closely with some other project. I guess we will be working closely with the BC Human Rights coming down the road. So that is also another area. So more you collaborate for the advocacy role, change or influence, the systems change, the better it is, the more focused will be. I guess that's one. I think there was one struggle from a newcomer that she was one-time newcomer, but I guess what was that was, let me see here. I think that was a very important point that she, forgot that, where did I write here? I think being single and being disabled and being a newcomer, that is a whole different lens and level of intersectionalities barriers that people does face. Sometimes what happens when you have a family, you have also support within the family, but how would someone work who is someone single, who is in 50s, late 50s, who is newcomer, who has disability challenge, and who doesn't have enough income support. So that is a big thing for the policy, for influencing policies. Thank you.
Yeah, thank you, Koyali. You brought up the points very well. So yeah, moving on to Raj. Thank you.
All right. So I don't have my glasses, so I'll do my best to read my typing. So we started with the question, what changes in government funding do we want to recommend? And I think this table was very passionate about this particular subject. And I think, well, here, let me just read what we wrote. PWD increases should be made, especially in the amount earned per calendar year. Allow the PWD individuals the opportunity to grow in an employment position since they've earned it, right? PWD benefits should be used to cover additional disability expenses. So even if they earn 50,000, 60,000 a year, they should not be revoked. They should, because we were discussing how certain disabilities have, really high expenses, right? And who's going to cover that? So, the fact that should not be ever taken away. We felt that the policies were all outdated and they need to be revisited. So kind of a house cleaning, go in, take a look at everything. And also maybe creating a health credit that can be added to the benefit as well. So on the side, and I think the table really enjoyed Forrest's comment with organizing PWD individuals and how to help them advocate to the government, because we do think that is probably the best representation, right? Going on to the next, is there anything you guys want to add to that? No? Okay, and going on to the second question we discussed was how can disability and newcomers organize and better collaborate? When assisting a newcomer, there are many different aspects that need to be addressed: healthcare, education, medical, etc. So it's impossible for one organization to address. So we were talking about organizing the organizations, to keep them, maybe get something more centralized. Maybe create an internal map of all organizations or an internal online portal where organizations can kind of visit and we can see what's happening within the other organizations, and that's kind of a way to kind of navigate. We also were talking about, can I mention your name, Karen? Okay, somebody on this table, I'm not gonna mention, had a really good idea about the city of Vancouver would be a great hub. As even, like you say, if you're a newcomer to Canada, especially BC, you say you live in Vancouver, right? So everybody searches Vancouver. And if you're not even landed in Canada yet and you're searching from abroad, you would probably search city of Vancouver as a place for a resource. So that may be a good place to start. And within the city of Vancouver, we would have a platform with all the information and in there subcategories for different cities and links within there, because it's just the first thing people think of, right? I even say it, I've been born and raised in Burnaby in New Westwood. When I go out of town, I'm there, where are you from? Vancouver. It's just easily understood, right? So I think that was a really obvious, but a really good one. Also, okay, going on to the next question. What changes in government policy do we want to recommend? Again, we came up with the roadmap explaining the differences between federal and provincial benefits and what's available. Clarity defining the status of a newcomer and the resources they're allowed to access. When somebody is landed in Canada but has not got their permanent residency, what do they qualify for, and where do you find that information, right? Instead of chasing it all down. A shared policy, meaning that, you kind of go to one organization, they tell you one set of policies, and you go to another, there's a different story there. So kind of a kind of broader stroke, kind of covering everything there. And universal forms and documents. So you could fill out maybe one or two documents and you're good. So you don't have to keep on coming back and redoing paperwork, which is a big barrier. Anything else? We're good? We're ready to drop the mic? Oh.
Thank you so much. Wonderful points. I believe all of you have done brainstorming very well. So yeah, moving on to our next table.
I think Hugo's table hasn't gone yet. Apparently I'm the report back person. So we had a wide-ranging conversation with many effective and important points that I had to figure out how to organize. A couple of points that came up, largely on how newcomer and disability organizations can better collaborate, and what are some of the pieces of knowledge that one sector is missing that the other has, and vice versa. One was translation. I'd mentioned that, I never thought of subscribing to one of those translation services before for our info hotline. But it's something that's relatively easy to do. And we talked about the sort of how the translation works at Mosaic and how, what we could learn from that we just never thought to ask, really. And that kind of spread to talking about the value of partnering together on shared social meetups to sort of promote inclusion, but also it helps some of the numbers game, because many of our sort of disability areas are relatively uncommon and even less common in newcomer circles. So how do we create an experience that's engaging and valuable and meaningful, where our organizations can come and offer lots of different experiences that give them a sense of what you can engage with, what you might want to do, with enough people to enjoy it. We talked about having those events be not just only for newcomers, but especially sort of having enough supports that newcomers would feel at home and feel like they had all the supports that they needed to take part. And we talked about a policy issue, actually, the experience of some newcomers with not having the access to, basic accessible showers to be able to shower at home and PWD support. The waiting lists are really bad for that kind of accessibility renovation support from the government. And I was thinking while we were all talking, and you guys over there talking about storming, changing the PWD system, it inspired me. And, it occurred to me that maybe, we have systems by which we invite newcomers to Canada and offer them supports. Should we not also be offering the appropriate level of support for the newcomers' needs if they have a disability? And just like pie in the sky, like how can we advocate so that newcomers with disabilities, as soon as they arrive in the country, they have sort of a package of financial supports that follow them until they have enough accessibility and an accessible place to live. And it feels almost impossible knowing how few accessible units there are available. But that if I could design it from scratch, that's how I want to do it. I want to make it so that lineup isn't something that a newcomer coming from a place that they couldn't stay didn't have to also wait 3 more years. We talked about the opportunities that disability rec and sport organizations have to sort of support the activities of newcomer organizations as a way of sort of offering support, but also sharing with sort of that benefit, but in the newcomer space, and sort of enhancing those activities. And then we talked a lot about sort of the core communications and how this group of people could come together and intentionally to build a network and communicate intentionally with each other, maybe through a regular newsletter that would like highlight the different activities we're doing, maybe helping to avoid too much duplication, but also opportunities to support each other in the services we're offering. And there was mention of sort of more holistic wraparound services, for example, for mental health, to make that more accessible and without so many different steps and applications. And if I was president, I would want, or premier, I would want to work with the health authorities to create a sort of, especially for the folks with mobility disabilities who need a lot of equipment and have a lot of complications, to create sort of a combined clinic with an OT, social worker, family doctor, and peer support to sort of, maybe it's quarterly or twice a year or something. So everything's kind of like put together. So if you have a lot of barriers, you need translators, are coming through between the 2 different funding systems for equipment. You have like people with lots of experience in that to help, like the Newcomer health clinics in Toronto. So that's all I have to say.
Thank you so much. Yeah. Shiva, would you like to add? Thank you.
Not much more to say after all that experts, so I'll just focus on maybe some things that I think were not mentioned, but I probably were. First, maybe training a specialist in settlement agencies, having a specialist to serve persons with disabilities, I think would be very important. And this person can be connected with everyone else. It's what we're trying to do with SAM. But our challenge there is Mosaic's so big and programs are so complex that it takes time to do the onboarding of someone. So yeah, if you have a specialist, that would help. Have a pool of translators. This doesn't mean that we have Mosaic and there's a huge commercial. We have that for-profit side of Mosaic that we could service everyone, and we do it, WorkSafe BC, 911, but also with the communities, right? And with the consulates and with even volunteers that speak when it's not so complex or it's not a legal matter, we can always have volunteers that are willing to do it. Yes, and the personal contact, having that personal contact between agencies, between settlement and persons with disabilities, and having that space. Neighborhood houses, I think, could be a good beginning to have all of us meet, right? And then for changes in government funding, it was both general and very specific. Specific for training and for settlement workers on disability, right? Because many times when we do our call for proposals, we have very specific funders, IRCC, SDC, but that doesn't include 10 hours of training for servicing persons with disabilities. And maybe we should start including that in our CFPs, right? So this is something that we can talk with our funders also. And the Minister Qualtrough is the same for migrant workers as for disability. So I think that's a good connection that we can make there. Then also directly, just in general, making things more accessible, especially housing. As a newcomer, if you don't have where to live, you can't even start thinking about working, right? Or both things come in hand, and it's very complex and very stressful. And housing is stressful for anyone in BC or in Canada. It's not, and if you don't know the language, and I would say even for myself, when I came, you don't even have a reference. Okay, so yeah, I'll rent it to you. What's your reference? Oh, I'm new, I'll be goodbye. I see a risk, you're not having the house. So I think we can also have a support system for newcomers with disabilities regarding housing. Of course, yeah, increasing the amount they receive. And government policy, I think two things. One, having what we see with the arrival of Ukrainian refugees is a huge capability of government to ease the way persons arrive to Canada and have benefits. So if that was done for the Ukrainian refugees, we can probably ask that the same be considered for persons with disabilities, right? Just a free pathway. And something that I share with my team, and we've been talking in our cluster meetings, also to go to the other side. Who makes the policies? So I would like to be in a room with the policy officials, which I respect very much because I was a public servant, so it's not an easy job. So everybody that is involved in changing a policy, a person with disabilities, in one room from the federal government, the municipal government, provincial and federal, all in the same room, telling us how hard their job is and who has to be in the room to finally change a policy. Because or else we're gonna be in these forums talking for ages, and what we really want is not going to be done. So unless we have the right people in the room and all of you have a network, let's put a paper and have those names, and whoever has pull to put those people in the same room, let's do it. The next forum has to be with the persons that change the policy.
Should be.
And we have to understand also what their difficulties are. And then maybe they're going to say, yeah, well, go push that MLA, and then that PA, and then everyone, right? And pressure here, pressure there. But then the pressure is strategic. It's not a waste of time and resources, right? It's just an idea.
Thank you, Hugo. So these were really wonderful points that you all have brought to limelight. So we are left with, kind of 15 minutes. And I would like to devote the rest of the 15 minutes on to the actionable solution, any recommendation, and final conclusion. So what do you think? Any person like that? Yeah, I thought the online people have left. I got to know that. Are they still there?
Well, I know Heather was running one.
Okay.
And then Sam was running another.
Okay. I got to know that the closed captioning was not there, so participants left. So Sam, would you like to share the points?
I think you already guys mentioned all of the important points. I don't have much to add to this, but I just wanted to add the policymakers should be people with disability. You know, you should not do things for us without us. Yes, yes. And I don't know if it's related, but there is a wonderful service in BC called HandyDot.
Yeah.
And the way it works, it's not very beautiful. It is not helpful. I mean, I hope one day we can change that. The way it works is just like many days, I really wish I could use the service. For example, from North Vancouver to go to Burnaby, almost like Joyce's station, to go to work. So I wish I could use the service, but because I live in North Shore and the work, like my work is in somewhere else, not North Shore, the way that they're going to support me, that's wasting my time. And I have to also pay for this service. I mean, yeah, I think you already mentioned all of the things, important points. Thank you.
Thank you. Thank you so much. So yeah, we have many points that have been that have come up out of this discussion. So I would like to request for any actionable solution, a final actionable solution that you would like to recommend regarding any one of the pointing discussion points that was to collaborate or to make change in policy and funding. A little bit more elaborative on one of the points. Okay, so before you think, I would like to add here that to be on a collaborative platform, I believe that there should be the link of all nonprofit and profit sectors who are working for disabilities in such a way that when we click any organization and there's a disability sector and there are a number of services onto there, and when we click them, even if that service is not available onto that organization or company, it can lead us to the other organization who serve in that context. So in that way, we all would be collaborated, and whosoever visiting whichsoever website will be going to the resources that are available out there. And along with that, I believe our websites, they are not very much accessible. So I'm very much impressed with the Disability Alliance Species website, which is really accessible. When we open it, a blind person can really understand onto what page they are. There are many accessibility options over there. So I believe while we are developing any centralized web source, there should be accessibility context to that as well.
I guess one of the actionable item, I guess me am saying it from my end, is VLIP will be very interested and welcome to work with any organization. So we are also learning. So I guess we need support when we are creating this knowledge hub, that one place that all the resources will be going, because we are also working with the government as well. So our informations will be on there, their informations will be on our, that is also in the government. So we are not expert, VLIP is not an expert, but we need a support, maybe one organizations or maybe whoever would be able to help us build that. So we will have resources to go on that process. So I'll take back this information and make it as one of the actionable item commitment.
I just wanted to request my dear friend Adrian, if we could have the contact list of everyone here, because there's so many good contacts, and right now probably at 5 we're all going to run. So yeah, so I think if we can have that contact list and just a brief thing of what the name, the contact, and what that organization does will be very useful, because we can put a face and then we can connect, because there's a lot of things to reconnect here about. Yeah.
Very much needed practical outcome of this forum, because once we will leave, we hardly get time to even contact back with each one of you, right? So that's really, really important. And any other actionable item that you would like to discuss while we are approaching closure regarding funding and policies? Yes.
She's on. Yes. So I talked to my group before. One thing that I'm very curious about is, in your network, is there any organization providing mental health services? An example, CMHA. That's just an example, doesn't mean that that's the only one. So we heard staff from agency talking about the need for mental health services there. It's like the elephant in the room is right there, but we don't quite talk too much about this. And in terms of funding, my vision is to create a hub where different services is provided. For example, language training, ESL training, employment, mental health counseling. So we have everything under one roof, so the client doesn't have to go to different direction. If we can create something like that within one place, that would be beautiful. And I think that would be palatable for the government to fund that as well. So organization working together to achieve this goal would be very ideal from my perspective. Thank you.
So Koyali, what do you think? How much it resonates with Knowledge Hub?
Yeah, I think that the vision is, we have already started working. There will be a team of government bodies will be coming in to talk about basically newcomer research and newcomers accessibility and research opportunities. And we are thinking how best we closely work with them for the next 3 years. So if that's something a high need, definitely would be an option. They're also very open for having a lot of communications with agencies that serving newcomers. VLIP can hold a very focused discussion that they will be able to help as well. But yes, Knowledge Hub, yeah, through that, I guess we can, there's a link, huge link.
Thank you. I know a website I recently came across, Wellness Canada. and that provides free mental health services like counseling, counseling support, and even that website is can be accessed in 200 different languages. So like I can recommend you one of that resource for you to check it out. Yeah.
Thanks, Anu. It's Helene again from Disability Alliance BC. I'm not really going to say anything that's like groundbreaking. It's more just a summary because I've been taking notes of everything that people have been saying. Yeah, some of the things that we can do as action items is conducting an environmental scan of all the resources that are out there. There might already have been an environmental scan done, but we don't even know about it. Obviously, that type of scan may need funding. A number of the points that we've made about collaboration really need to be talked through in a regular working group amongst Newcomer and disability organizations together, just so that we can do more of that organic collaboration. And then for funding, action items are funding for training for Newcomer organizations regarding like disability, funding for broad spectrum navigators. And then on the disability service organization side, funding for translation and interpretation services so that we can better support newcomers, but also funding for disability service organization training on the newcomer experience. So that's what I've had. That's probably not everything.
Thank you so much. Anybody else would like to add on to it?
It's Chris McBride from Spinal Injury BC. This all took an enormous amount of effort to get going, and I would like to thank the Disability Alliance BC and the Disability Foundation and Hugo Mosaic for bringing us all together. This is the first step. This is the first conversation that we've had with each other. I think we're all probably a little timid in the way we sort of approach it. We touch on the easy parts and not so much on the hard parts. And I think the most important actionable thing that we can do is to commit to continue to develop our network, to develop the relationships that we have here, and then come to a point where we can speak with a unified voice to the policymakers, to government, to really affect that change. So I hope that this is just the beginning of a very long and rich dialogue.
Thank you for concluding. Actually, so moving on to final recommendation. Anyone would like to take the lead for this conversation? Final recommendations. Yeah, I think we should create another plan to meet and come with more, clear vision, what would be our next step in the process of being more collaborative. So yeah, I think, that's very important.
I just want to say a really big thank you to Adrian for getting all of us here together. Just wondering if the CC is correct up there. Do I close captioning?
We're having issues with that.
Okay. That's it. That's all I wanted to say.
Okay, thank you. Anybody else? Yeah, sure.
Hi, everybody. I'm so glad and thankful for everybody that I'm here. I don't know if I have the right to say things. Please do not take it as it is. But if we don't fix the system and the problem, I don't think it's fair to bring people here that are looking for better, especially with disabilities. But when they come here, they can find different things. Like we should fix first the system for the citizens and PR and people already living here, not to bring more people and do things worse. Sorry about that, but this is my opinion. Thank you for everything. Hoping that will change soon. Thank you.
Thank you so much. Yeah, it's altogether another perspective, and we respect that very much. Anybody else? Okay, so I think it's time to conclude the event. I believe it was a wonderful discussion platform provided to all the attendees by Disability Foundation, Mosaic and Disability Alliance BC. The study shared by Adrienne in the starting was really informative, and that laid down the framework for this discussion. The panel of experts who shared their valuable time and knowledge in action is really appreciated. I also appreciate presenters and our attendees, without whom this would not have been made possible. I would also like to acknowledge the City of Vancouver and Vancouver Coastal Health for funding this forum. I hope we are going back with hands full of new connections and collaborations you made during the event, and minds full of new thoughts, vision, and hope. I hope that actionable outcomes from brainstorming would be able to find a space in government policies, and for sure the next actionable item should be to get together again and work in this direction. Loophole in our working strategies are keeping a whole kind of talent pool out of our society, and because we have made this gathering possible, it is because we kind of share a common vision and common goal, and I hope that we will stay in touch, keep communicating, and yeah, we will work towards creation of more inclusive society. Thank you so much.